Hi guys, it's Vicky the vet. Welcome back. So great to have you here joining me. Today what I'd like to do for you is another exam room spotlight. And today I'd like to focus on the sore ear. So if you've shared your life with a dog, either just once or many times, it's really highly likely that you've come across sore ears before. It's just super common, and it's something which is incredibly painful. So that's why you'd notice it if it's happening. It's not something that's easy to miss. It's going on. They're very irritated, very sore. And some of the most aggressive patients that I've seen have been patients that have chronically sore ears. And once we get these ears under control, it's just incredible the transformation that we see, that we can actually then touch and be friendly with these dogs again. So this is the ear consult and what you should expect from your ear consult. I'm a huge believer that if you're coming into the clinic with a bit of preparation and you understand what it is that you're in for, and the flow of the consult helps you be ready for what's going to happen. And because things that are happening aren't a surprise for you, then when we start getting into the consult, you're more prepared to contribute and can actually be part of forming a plan for your pet. So first things first is a medical history. We're always going to start these consults getting some really key information off you. How long has that ear been sore for? Has there been any recent exposure to water? Have you had ear infections in the past? We're going to take a little bit of history now, try and get to the bottom of this problem, and then when we see you back for rechecks, we do another deep dive into some longer term ear history, because we really don't want this to happen again, or if it is going to happen again inevitably, we want it to happen as little as possible. The next part of your ear consult is a physical examination, and that sounds, I guess, it's not a surprise, but it's not just an examination of the ear. It's a physical exam from snout to tail, and what we're looking for there is indications of general health, and particularly any clues as to why the ears might be infected. If we start looking, do we actually notice that the feet are a bit brown or a bit red, and we might have some allergic skin disease, and that's why our ears are playing up? Is it that when we start having a look in the tummy and talking a little bit about bowel motions, that we figure out that we've actually got a bit of a sensitive tummy, and this might all be secondary to food type allergies? So definitely expect from your skin consult, for your ear consult, that we're not just focusing on those ears. You will get a full physical examination, and then we move to the next part, which is that detailed ear exam, and that's the one where you see the vet pull out the otoscope. That's the thing on the handle with the cones, and needing to have a look down that ear. And it's an absolutely essential part of the ear exam. So what your vet's looking for when they do that, they're looking, are there any ulcers down the ear canal? Is there anything stuck in there? Is there a grass seed? Is there a piece of stick that's stuck in there? Is that what's causing the infection? Do we have the eardrum? Is that broken? Is it ruptured? Because that's a game changer. So these are really important things that as vets we're looking down there. And if we can't see clearly down there, if your baby is just too sore for me to have a look at, or it is just too impacted with wax, we need to give that ear a good clean. And that can either be conscious if your pet is feeling comfortable with that, or if we have a severe impaction, your pet's feeling anxious, they're very sore, then quite often what we'll need to do is escalate to an anesthesia. Under an anesthesia, we will put in some medication that helps to numb the ear. And then whilst we're asleep, whilst the ear's numb, we give it a really deep, what we call a lavage, which means we flush out all of that wax, take a good look at the eardrum, make sure there's nothing stuck in there. And that gives our medication an opportunity to work. So if we're giving you medication and not cleaning the ear properly, the medication can't penetrate through wax and debris. So you'll treat the surface of the infection, but as soon as you stop your meds, guarantee you it is coming straight back. So that's a really important step. The next step, and if you've been to the vet before for an ear infection, you'll always see they're very, very keen to put a swab down the ear and have a look at it under the microscope. And the reason that's something that I'm really keen to do, and that as vets we like to do that every time, is because we want to know, is there infection there? And look, in most cases, it's generally pretty convincing that there's infection, but we want to know, is it there or not? If it is there, is it fungus? Is it bacteria? Is it both? And if that is there, how much of it's there? Because it helps us, if our ear infection is not resolving, it helps us to know, is this medication working at all? Is it working 50%? Is it working 20%? We might have an infection that's actually resistant to our medications. So that's really important for us to understand. Sometimes we'll also see on those samples mites as well, which just aren't going to respond to any ear medication. We need some anti-mite treatment. So there's lots of different things we're looking for, and it's absolutely essential. Don't let your pet get treated for an ear issue unless you've got that. It's really putting them 10 steps behind and keeping them quite painful for something that may be being missed. The next part is, if we didn't need to clear the ears to have a look down there during the examination, the next part is that we give the ears a bit of a clean. Make sure that we're removing that wax and debris for you so that the medication can actually work. Like I said, it can't get through wax and debris. That stuff needs to be removed. So if your pet's feeling nice and comfortable, we do that conscious. Otherwise, we administer a light anesthetic to do that. And the reason we do an anesthetic and not a sedation is because when your pet's sedated, they can actually feel what's going on. They just can't respond. And when you think about that, that's horribly traumatic thing to do, isn't it? That they're paralyzed, they can't react. They don't want us to do this conscious because their ears are so outrageously painful. And so sedating them so that they can feel it but can't react is just not the right thing to do. So we do give them a light anesthetic for that. And we also numb the ears so that when they wake up, those ears have had a deep clean, but they're actually feeling really, really nice and comfortable. What we'll do for you once we've done all of that, so you've had your medical history, full physical exam, done a detailed exam of the ear, taken some samples, cleaned out the ear, we're then going to look at finally getting some medications on board to you. And there's a few different ways we can give medication, and it really depends on your pet. If we're giving you medications to give at home, so for you to give every day at home, it's really important that you're giving a measured amount. So not just a couple of drops, one squirt into the ear. We actually like to give you a syringe and tell you, 0.5 ml into the ears twice a day, 0.3 ml, 1 ml into the ears twice a day. If you're giving a measured amount, we know that the patient's getting the right dose. And if you're not giving a measured amount, we very much run the risk of underdosing. And when we underdose, that's when we get these resistant infections popping up. So we really want to avoid that. Last and not least, I definitely need to see you back for a sore ear. We go through all of this trouble and having ear medications placed and cleaned and putting you and your pet through all of that, that the very last thing that any of us want is to stop that medication and it comes roaring straight back. And that's what that revisit's about. It doesn't matter that that ear looks good on the surface. You will get a cytology sample taken again of the ear, because my eyes, they're great. I've got 20/20 vision. I'm very blessed, but they're not little microscopes. And so we need to look at that under the microscope and make sure it's clear. Time and time again, I am fooled by ears that look clear but still have yeast infections. So your vet really, really needs to check that one. And then we need to talk about, well, why did this happen in the first place? Is it happening because we went for a swim? Do we need to get you an ear cleaner for whenever we're going for a swim? Is it happening because we have allergies? Do we need to get you a lotion to put down there once a week to help settle those allergies? And that's really important, because ear infections are absolutely terrible. They're super, super painful. And what we don't want is them coming back, or if they're going to come back because you've got a chronic issue, we want to see them as little as possible. so that we can get the most out of our pets and they're not suffering with sore ears, the poor little sausages. So that's my exam room spotlight on the sore ear and what to expect if you're coming to see a vet for a sore ear. Let me know in the comments if there's anything more that you'd like to hear, if there's anything that perhaps you want some more information on. More than happy to chat as always. I'm Vicky the Vet. Thank you so much for listening, guys.